Welcome back to Anatomy and Physiology here at AWC with your professor, Dr. Sean Clavel here. Today we'll be looking at the axial skeleton. So we'll start with an introduction before we look at all of these particular bones. Now, remember, the skeletal system is what forms the rigid framework of the body. It consists of bones, cartilage, and ligaments primarily. So remember, the bones support the weight of the body and allow for movement as well as protects our internal organs. Cartilage provides flexible strength and support for the body, such as the thoracic cage, the external ear, as well as our trachea and larynx. At the joints or articulations of the body, we have cartilage, which unites adjacent bones and provides for cushioning as well. Ligaments are the strong connective tissue bands that hold the bones together and serve to prevent excessive movements that might result in injury. The muscles, which are part of the muscular system, help to move the skeleton, which are firmly attached to the bones via connective tissue structures we call tendons. As muscles contract, they pull on the bones to produce movements of the body. Thus, without your skeleton, you wouldn't be able to stand, walk, run, or even feed yourself. Now, the human skeleton can be divided into two basic parts, the axial skeleton and the appendicular skeleton. As you can see here, the axial skeleton, which contains 80 bones, consists of the bones of the skull, 22 bones of the skull, 25 bones of the thoracic cage or thoracic chest cavity, the vertebral column, as well as the sacrum and coccyx. Some bones that are also included here but are smaller and seen in other sections of the anatomy and physiology are the auditory ossicles, so the small bones related to your sound, as well as the hyoid bone, which is the bone which gives leverage and allows for the swallowing as well as speech. The appendicular skeleton is made up of the bones associated with the limbs, which that also includes the pectoral girdle, which will be the scapula and clavicle, or the bones associated with the lower extremity, as well as their associated girdle, the hip bone or the pelvic girdle, as it's often referred to.